Hello everyone, and welcome to today's medical deep dive on a critical neurosurgical procedure, treating subdural hematoma, or SDH for short. Whether you're a medical student, a practicing professional, or just curious about brain surgeries, this is where you'll get a comprehensive breakdown of what SDH is and how it's treated. Now let's start with the basics. A subdural hematoma is a type of hematoma, basically a blood clot, located beneath the dura mater, the outer protective layer of the brain. This condition can be life-threatening and requires immediate medical attention. There are two main types of subdural hematomas, acute and chronic. Acute subdural hematomas are typically caused by severe head injuries. The blood accumulates quickly, leading to a rapid increase in intracranial pressure. On the other hand, chronic subdural hematomas develop slowly over weeks to months and are often the result of minor head injuries, particularly in the elderly. Diagnosing a subdural hematoma is crucial and is typically done through a CT scan. The CT scan findings for an SDH show a crescent-shaped mass between the brain and the skull. Recognizing these signs on a scan is key in the diagnosis and determining the right treatment approach. Speaking of treatment, there are primarily two surgical options for managing a subdural hematoma: Burr hole surgery and craniotomy. Burr hole surgery is often the first line of treatment, especially for chronic cases. It involves drilling small holes into the skull to drain the accumulated blood. In more severe cases, a craniotomy might be necessary. This procedure involves removing a section of the skull to access the brain and remove the blood clot. It's a more invasive approach but can be life-saving when large blood clots are involved or when the patient's condition doesn't improve with simpler surgeries. Both procedures aim to reduce the pressure on the brain, alleviate symptoms, and prevent long-term damage. The choice of procedure depends on various factors, including the type of hematoma, its size, the patient's overall health, and the presence of other injuries. After surgery, monitoring and follow-up are crucial. Patients might need additional scans to ensure the hematoma is resolving and not recurring. Recovery can vary widely. Some patients might recover completely, while others could face long-term complications. Understanding the complexities of subdural hematoma and its treatments is crucial in neurosurgery. It's not just about learning the procedures, but also about understanding the impact on a patient's life and how to optimize their recovery. Thank you for joining me today to explore the intricacies of brain surgery related to subdural hematomas. Whether you're studying for your exams or simply expanding your knowledge, I hope this video has been informative and helpful. Stay curious and keep learning.